This is our first look at getting some perspective on health sharing ministries from the other side of the exam table, so to speak. And we're really privileged to have Dr. Potter with us. Are you finding more and more medical professionals, doctors, surgeons, specialists, are they becoming a little bit more open to that type of methodology? I'm sure they'd all like to separate in some way, shape, or form from the regulatory burden and all the garbage with the forms and the paperwork to get paid.
Oh, absolutely. Definitely in the primary care world, where it's a whole lot easier to step outside of those because more patients are realizing that 12 to 15-minute visit is not enough to address their needs. And direct primary care means that you can actually spend 20, 30, sometimes 45 minutes or more with a patient, and you're not involving an insurance company who will never pay for that. So on the primary care side, it's working out great. Then because there are more patients that are being involved on the primary care side, the specialist side are starting to get in on the action too, simply because specialists need thousands and thousands of a catchment area, so they can't just say, oh, all I need is a locale of 5,000 people. Primary care, all they need is about 2,000 to 3,000 patients to be able to take care of business, whereas specialists need more. But when you have 50 or 100 primary care practices, each with 2,000 or 3,000 patients, then you have enough patients who need those specialists, which are, again, a smaller percentage, and the specialists can start doing that. So we're seeing more from orthopedics to some other specialists who are being much more open and either doing a hybrid practice where they're doing part direct pay and part typical insurance, or they're going all into the direct pay for simplicity and being able to simplify their practice as well.
So are you seeing that grow? That's continuing to grow?
Yes, the numbers are growing. There's several websites out there that support the direct pay care, direct primary care, that shows that more and more physicians are getting tired of the complexity and the burden of insurance companies, Medicare, Medicaid again, and seeing that they can actually have a business and actually have a more enjoyable practice in their clinic by taking care of patients outside the typical insurance model.
So are you finding doctors, once they accept the health sharing, are they more receptive? Are they more likely to open up their practice to it more and more?
Yes, and it's kind of like when I went to med school years ago now. I went in thinking, oh, this is going to be taking care of patients. But I popped out into practices where, oh, we're taking care of insurance companies. We're filling out forms. So most doctors know there's a problem. They know that our current system is not functional, either for the patients or for them, and them actually having a life without having to spend time doing things they don't enjoy, paperwork, crossing every T, dotting every I on every single paperwork. So they know there's a problem. However, they are learning that there's a solution. Like when I first learned about direct pay care about 6 years ago, I was like, that's legal. It's actually allowed that you can just take payment from patients. Once you break through that kind of glass ceiling of sorts, is you're realizing, oh, this actually works a whole lot easier. There's not a complex solution. It's actually making things more simple by doing it directly with the patient. So once doctors get through that kind of barrier of, oh, it's actually legal to do something like this, it actually is business, a good business decision, they get on board pretty quick. But like many other things, it's an educational matter because they've got to learn to think differently. Once you break that barrier, you've got to think, how do I do business different? How do I care for patients different? How do I function differently in a clinic? But it's a learning curve, but once physicians get past that, it is much easier.
Hey, I want to thank you for watching the clip. We sure do appreciate it. Would you go right now, click on that subscribe button if you haven't already. That helps us. We would appreciate it. Thanks again.